Trauma can leave deep wounds, but the path to healing is also a path to building profound resilience. Effective trauma therapy doesn't just treat the past, it builds a stronger self, ready for future stressors. This isn't just talk therapy. It uses specific, evidence-based methods to reprocess trauma at its source. It also equips individuals with coping skills, like grounding, to manage distress in the here and now. How does this work? We'll break down the principles, the mechanisms, and the outcomes that forge resilience. First, what makes it different? Unlike other therapies, its primary goal is to resolve symptoms stemming from past traumatic experiences. It all starts with one core principle: creating safety. Trauma-informed care operates on safety, trust, and empowerment. Why is this so vital? Trauma shatters a person's sense of control. Therapy must first establish a secure environment to help regain that trust. This environment is a clinical necessity. It allows the nervous system to calm, permitting the deeper work of processing to begin. With safety established, the aim becomes clear. It is not just about stopping flashbacks. It is about building resilience and finding post-traumatic growth. So, safety is the container, and resilience is the goal. What are the actual mechanisms inside that make this happen? A key mechanism is reframing perspective. Therapy helps clients challenge beliefs tied to the trauma, fostering a sense of agency over their narrative. But how do you reframe a visceral memory? This is where EMDR uses bilateral stimulation to reprocess trauma. But how does that actually work? Another powerful method is trauma-focused CBT. It integrates trauma-sensitive interventions to address distorted beliefs and build concrete coping skills. Psychodynamic therapy offers another angle, helping process trauma by showing how past events actively shape current emotions. Though different, these methods share a purpose. They don't erase the memory, but they change its power, reducing flashbacks and distress. Reprocessing the past is one half of the equation. The other half is building skills for the present and future. What does that look like in practice? One of the most vital skills is emotional regulation. Therapy explicitly teaches people how to manage intense feelings, giving them tools to stop overwhelm. This involves creating concrete coping strategies for daily life. Clients learn to better respond to triggers rather than being controlled by them. What are these strategies? They can include mindfulness to stay in the present, or grounding techniques using the 5 senses to anchor a person. The result is a tangible improvement in the ability to handle future challenges. By learning to manage stress and fear, daily life becomes less fraught. So, the process seems direct. Create safety, reprocess memories, build skills. But is healing from trauma really that linear? Healing takes significant time and effort. That is why deep compassion and patience from the therapist are a core tenet of this approach. The approach must also be adapted. With youth, TFCBT is a proven intervention that involves parents to aid the entire family system. Returning to our question, how does EMDR work? The stimulation engages both brain hemispheres, allowing the stuck memory to be filed as a past event. This processing opens up a profound possibility. The goal isn't just a return to baseline, but fostering post-traumatic growth and a deeper appreciation for life. So we have the principles, the mechanisms, and the skills. How do these all weave together to create the final outcome? Resilience? Recall the need for a safe environment? That safety is the crucible where new coping skills like grounding can be practiced without fear of failure. And remember the memory reprocessing mechanisms like EMDR? By changing the past's narrative, they create the mental space for post-traumatic growth to happen. This is the core insight. True resilience is not built from one element alone. It is the result of integrating a secure relationship, targeted reprocessing, and new skills. Therefore, trauma-focused therapy is not just a method for healing. It is a complete system for building a more resilient human being. We've seen how this therapy creates safety to enable healing, uses powerful methods to reprocess the past, and equips clients with skills for the future. This proves our initial point. The goal is lasting, long-term resilience. It leads to a stronger sense of self, ready for whatever challenges come next. For mental health professionals, a trauma-informed framework is a requirement for effective care. These mechanisms facilitate profound healing in our clients. Resilience is not something people just have. it can be built. Share this video to help spread the understanding that healing is possible and a stronger future can be forged.